My name is Amy Pierce, and I am the Healthcare Associated Infections Program Coordinator with the Bureau of Communicable Disease Control and Prevention at the Department of Health and Senior Services. Today, I am going to talk a little bit about the novel coronavirus, share guidance for long-term care facilities, and give you some resources to use for planning and preparedness. Coronavirus disease 2019, or COVID-19 for short, was first detected in December of 2019. This new or novel coronavirus was first detected in China, but has now been found in over 100 locations around the world, including the United States. A novel coronavirus like COVID-19 is a new strain that has not been previously identified in humans. COVID-19 is not the same as other strains of coronavirus that are commonly seen in people and many different species of animals. Coronaviruses are a large family of viruses that cause illness, ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, or MERS, and severe acute respiratory syndrome, commonly known as SARS. A diagnosis of coronavirus does not necessarily mean the patient has COVID-19. In fact, COVID-19 can't be identified without specialized testing. Patients with COVID-19 will be evaluated and cared for differently than patients with a common coronavirus diagnosis. The most common symptoms of COVID-19 are fever, cough, and difficulty breathing, and may appear 2 to 14 days after exposure. Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed COVID-19 cases. Most people, about 80%, recover from the disease without needing special treatment. However, serious illness seems to occur in about 16% of cases. Older people and those with underlying medical problems like heart disease, lung disease, or diabetes are more likely to develop serious illness. Spread of this disease seems to occur most often when infected people cough or sneeze within 6 feet of a non-infected person. Other methods of transmission may include close personal contact, such as touching or shaking hands, touching an object or surface contaminated with the virus, then touching your mouth, nose, or eyes, and in rare cases, contact with feces. Care for infected individuals is supportive therapy only, as at this time, there are no medications specifically approved for COVID-19. Most people with mild coronavirus illness will recover on their own by drinking plenty of fluids, resting, and taking pain and fever medications. However, some cases develop pneumonia and require medical care or hospitalization. Robust infection prevention policies and practices are critical to stopping the spread of COVID-19. The Centers for Disease Control and Prevention, the CDC, has a web page specifically for long-term care facilities entitled Interim Additional Guidance for Infection Prevention and Control for Patients with Suspected or Confirmed COVID-19 in Nursing Homes. These recommendations acknowledge the increased risk of many residents due to age and underlying chronic medical conditions. This website has important guidance that long-term care facilities should utilize, presented in a tiered fashion based on whether COVID-19 has been identified in their community or facility. It breaks down activities facilities should undertake before there are cases, when there are cases in the community but not in the facility, and when there are cases in the facility or there is sustained transmission in the community. The Centers for Medicare and Medicaid Services, CMS, has recently provided a guidance document entitled Guidance for Infection Control and Prevention of Coronavirus Disease 2019 in Nursing Homes. It was revised on March 9th to include guidance for monitoring and restricting visitors as appropriate. The guidance directs long-term care facilities to actively screen visitors for signs or symptoms of a respiratory infection, such as fever, cough, shortness of breath, or sore throat. Visitors with any signs and symptoms should be restricted from visiting. Other restrictions include visitors who have been in contact with anyone who has been confirmed positive for COVID-19, is under investigation for COVID-19, or who is ill with a respiratory illness, anyone with a travel history within the last 14 days to countries with sustained community transmission, or anyone residing in a community where community-based spread of COVID-19 is occurring. Be sure to consult the guidance for all recommendations for limiting or restricting visitors to your facility. The CDC also recommends good communications between the facility, residents, and staffs to ensure everyone understands what their roles and responsibilities are for protecting themselves and their fellow residents. Continually monitor residents and employees for fever or respiratory symptoms so that prompt action can be taken if someone begins showing signs of illness. Promote hand and respiratory hygiene, as well as cough etiquette by residents, visitors, and employees. Make alcohol-based hand rub and tissues readily available throughout the facility, and make sure that sinks are well stocked with soap and paper towels for hand washing. It is very important that staff are well trained in infection prevention strategies. If possible, there should be dedicated staff for caring for COVID-19 patients. Ensure that employees have the correct supplies and proper personal protective equipment, such as gowns, gloves, eye protection, and face masks, and are well versed in safely donning and doffing. CDC offers nursing home infection preventionist training, which includes resources and checklists for facilities and employees to use. It can be found on the CDC TRAIN network. CDC also has a site titled Interim Infection Prevention and Control Recommendations for Patients with Suspected or Confirmed Coronavirus Disease 2019 in Healthcare Settings that should be consulted for guidance on minimizing exposure risk, patient placement, environmental infection control, and other general infection prevention strategies. Finally, in order to prevent spread between facilities, notification should occur prior to transferring a resident with an acute respiratory illness, including suspected or confirmed COVID-19. The CMS guidance mentioned earlier also has information on when facilities should consider accepting or transferring residents with suspected or confirmed COVID-19. And of course, please remember to report any possible COVID-19 illness in residents and employees to the local health department. Please continually monitor the state health department and CDC websites for updated information. The situation is changing rapidly and guidance is being continually updated. The section for long-term care regulation will also be sending out updates through its listserv. Now I will speak on a couple of other things of note. On Monday, March 9th, the Department of Health and Senior Services released a health update titled Updated Guidance on Evaluating and Testing Persons for Coronavirus Disease 2019. This guidance provides criteria for patients who will be accepted for testing at the State Public Health Laboratory. Of interest to long-term care facilities, for patients who fall outside the criteria for testing at the Missouri State Public Health Laboratory, symptomatic adults 65 years of age or older and individuals with chronic medical conditions and/or an immunocompromised state may be considered for priority testing at commercial laboratories. If testing is not available through the State Public Health Laboratory because the patient does not meet the criteria contained in the health update, it is important to know that commercial testing may still be available. It is also important to note, however, that though the ability to test has been expanded, the availability still may not meet demand unless clinicians use their judgment to assess the appropriateness of the testing. Without evidence to suggest infection with COVID-19, such as contact with a positive case, travel to an area with identified ongoing transmission, or evidence of local community spread, clinicians are strongly encouraged to test for other causes of respiratory illness, such as influenza, before considering COVID-19 testing. And finally, if you have further questions about COVID-19, the Department of Health and Senior Services has opened a hotline dedicated to providing information. As of March 11th, the line will be available 24 hours a day, 7 days a week. It is staffed by medical professionals who will be able to answer questions, provide resources, and refer inquiries to subject matter experts as appropriate. The number for the hotline is 877-435-8411.